COVID-19 pandemic-related lightning talks presented by Marquette COVID-19 Research Initiative. And just before we get going, just a reminder that this meeting is being recorded. My name is Sandra Hunter. I'm chair of the COVID-19 Research Initiative Steering Committee, which is under the umbrella of the Vice President of Research and Innovation, Jean Hossenlopp. And shown here are the variety of faculty and students also on the steering committee who help in this venture. And just a reminder what the primary goal of this research initiative is to identify and promote research performed by Marquette faculty, staff and students on the immediate and the long-term issues and the impact on society related to the COVID-19 pandemic. And that can be large and small research collaborations, interdisciplinary or individual investigators, and short and long-term research projects, and particularly educational opportunities. And shown here is a list of speakers and topics for today, which are quite a wide variety. We've got 12 speakers. Each will get 5 minutes, and there will be a chat. There is a chat that can be quite active. So you can put questions in the chat and we can have a conversation at the end. So to get going on today's talk, I'm starting the proceedings with student research initiatives during the pandemic. And so March 2020, last year, really did change for the world and for Marquette and for students and their summer plans. And many of the summer student research programs were cancelled. That included those in the College of Health Sciences, Biological Sciences, and also the Athletic and Human Performance Research Centre, as well as Public Health Equities. And they're just a few of the programs across campus where students weren't allowed to come onto campus and do their research as planned. And so they were all cancelled and closed for business. But this also created new opportunities. And one of those opportunities that started and sprang from and came to life was the Marquette COVID-19 Research Initiative, which sponsors these lightning talks. And we've been in existence now for 1 year, which is actually incredible because at the time we thought it might be a few months. And out of this came real innovation, new visions and methods of delivering educational experiences. And I just want to highlight a few of those. And I thought it was put really nicely by Dr. Leslie Knox, who's the history chair. And when we were giving a talk to University Advancement in September, she said the COVID-19 Research Initiative really demonstrates the importance of thinking together across disciplines to respond to urgent issues in real time. And this is the clincher here. It teaches and empowers students to make sense of what may seem unfamiliar, disorienting, and new. And we take being the difference from an abstract ideal to a hands-on reality. And that's what we did at the Research Initiative. And we really tried to empower students with new research opportunities where there was a big void. And we put this into diagram, and I did write about it in Medium, Tools of Discovery and Survival. And this is just a diagram with a student at the centre, and it's all about discovery and this blurring of lines between teaching and research. And so some of the research initiatives that we started with, one of the first things that we did was student commentaries, because that's the foundation of research, trying to understand what the lay of the land is. And so we asked students who were in the lab or typically would have been in the lab if they'd start to write commentaries around what they see and how they're being impacted and how they're seeing the world being impacted by COVID-19. And one of the first ones that came out was that of Mike Heischer, who's on this call and helping, and he'll be talking next, but also he's a graduate student and also the Athletic and Human Performance Research Lab Manager. And he was asking, does mask wearing make a difference in the spread of COVID-19? And these are all up on the our innovation website. And out of this blog came the question, who is wearing a mask? And whether it's males or females and age, because at that time, and this was back in May and June, we weren't sure if how effective masks were, or some of us thought we did, but we didn't know who was wearing a mask and who wasn't because they weren't mandated at the time. And so together, we had 6 students and 2 faculty, including myself, and the students were deployed across where they across the county, and they went and stalked grocery stores and started counting who was wearing a mask, male, female, rough estimate of age. And out of that, we got a publication. We published our data, and that came out in October 2015. But here's the deal. It was a fantastic research experience for these 6 students, and this is the impact it made. As of yesterday, we've had over 23,000 article views. So this is 6 months in. Over 3,000 downloads of the article, 46 citations already, and 4 media interviews. This research had an impact. It filled a gap, and there were students involved. Other student experiences besides the commentaries, and we've got 13 of them up on the website at the moment, is that we started a COVID-19 Research Initiative Summer Undergraduate Research Program. And that was led by Gigi Mackie in Bisc and also Tony Urick, and I'm really indebted to them, where they took about 8 students and walked them through a program online where the students were doing virtual research. And it was just a great experience with people giving presentations, and it just really did fill a gap. Another few initiatives that occurred were in the academic year. We shifted some of the programs that were from summer and we shifted them into the academic year, including the Public Health Equity Fellowship and the AHPRC Student Research Initiative. And they're just wrapping up in these next few weeks. And finally, I want to highlight the COVID-19 COVID Conversations podcast, because that was really innovation in action. And that is still being led by Leslie Knox, whose idea it was, and a team that she has just listed here. It's interdisciplinary. There's at least 20 episodes in the first season, 2 episodes for the season, this season. And it's just a fantastic podcast that has high student involvement. And so they're just some of the highlights of the student activities that have occurred during this pandemic and how we've really filled the gap. So that's the end of mine. We're going to now skip to Mike Heischer, who is going to be talking on the functional characteristics of adult COVID-19 survivors.
Thank you very much, Dr. Hunter, and thank you all for attending the Lightning Talks event today. Next slide, please. So let's take a minute to provide background on what is now being termed post-acute COVID-19. Here you're looking at a really nice graphic from a recent review that was published in Nature Medicine, showing the viral load over time and how that relates to post-acute COVID-19, which is what affects the long haulers that experience persistent symptoms beyond 4 weeks after their onset. At this point in time, individuals will PCR test negative and not be contagious, but they may endure a wide range of symptoms for months afterwards. And so our study was really designed to investigate many of these lasting effects with strong consideration of factors that may modify them, such as age, gender, severity of illness, and physical activity. A recent study of almost 50,000 adult patients associated physical inactivity with more severe outcomes. So it'll be interesting to see what impact that has on the long-term effects of the disease. Next slide, please. So as you can see, we have tested 21 individuals to date, including 15 COVID survivors and 6 matched controls. We have a wide age range in our sample and have had volunteers from Marquette, including students, as well as individuals who were recruited from the community. Next slide, please. Now I'm going to talk about a typical testing day for a participant within our study in the context of some recent literature that has come out. So upon arrival to the HPRC, participants complete consent documents and take a COVID-19 test that is done via nasal swab. Participants will then complete a variety of surveys that aim to assess psychological health and well-being. A really striking report came out recently that noted COVID-19 infection in comparison to other health conditions results in increased risk of psychiatric disorders. So we're really looking for signs of depression, anxiety, increased stress, and any changes to sleep health, among other things. The study of pain is also a large component of our project. where we aim to evaluate the perceptions and types of pain that our participants experience, along with assessing how it may impact their function. In the upper right-hand corner, you can see the body map that we show to participants to allow them to specifically indicate where their pain is occurring. Alarmingly, we have had COVID survivors in our study report widespread body pain, and some participants have also noted pain in multiple locations, including the head, chest, knees, and low back. After the pain testing, we move on to assessments of body composition and bones. We do basic height and weight measurements, as well as DEXA scans, which is basically like a fancy x-ray machine. In addition to a whole body scan, we also do bone scans of the hips and lumbar spine, as these are locations that are common areas of fracture, especially among individuals with poor bone health. Next slide, please. So after the DEXA scans, we move on to muscular strength and power testing, where we strap the participants into this chair and they do some maximal effort knee extension and flexion. We also do a fatigue test where we have the participant perform a maximal kick every 3 seconds over 2 minutes, and then we calculate the loss in force or power. Next slide, please. Continuing on, we do some lung function testing. Spirometry is actually now being recommended to assess progression and recovery from COVID-19 because of the reduced lung function and lasting restriction that can occur, especially in those more severe cases. We look at heart rhythm with ECG. We do a taste and smell test using a highly scientific jelly bean-based protocol. So for this test, we blind them to the flavor and then ask sour, sweet, salty, or savory. Interestingly, almost half of our COVID subjects have failed this test so far. And finally, we do a stress test on an exercise bike to evaluate an individual's capacity to use oxygen during activity. Next slide, please. So that gives you an idea of what a typical testing day looks like for our participants. Looking ahead to the summer, we are excited to add a qualitative piece to our project. We have put in for CTSI funding and are also very grateful to have received a small grant from the Institute for Women's Leadership to support some students over the summer. Obviously, we'll be ramping up data collection and moving further into data analysis as our subject pool grows. And finally, we've discussed whether or not coming to the AHPRC may actually be a barrier for some individuals that we might want to include in the study. And so to that end, we're thinking about taking the show on the road to do some community testing days with a smaller battery of assessments. Next slide, please. So that's all I have for today. If you have any questions, feel free to reach out to myself or any of the expert faculty investigators we have in the project. And if you're interested in volunteering for participation in the study, you can get in touch with us via the phone and email contact you see on the slide. Thank you.
Excellent. Thanks, Mike. Okay, up next is Dr. Sheila Schindler-Ivins, and she's going to be talking on the 2020 pandemic, a lens for understanding how research informs healthcare. Thanks, Sheila.
Hi, everyone. Thanks, Sandra, and thanks, Mike, and all the others on the COVID-19 Research Initiative for this opportunity. I'd like to share with you how an initiative aimed at bridging the gap between research and practice in physical therapy pre-COVID morphed into a science and healthcare literacy program post-COVID. Next slide, please. Prior to the pandemic, my group was working on a project funded by an Explorer Challenge grant to help physical therapists bridge the gap between research and practice. Next. When you advance them, so I have to also, Sandra. Our initial strategy was to embed in the Marquette University Physical Therapy Clinic, where we asked frontline clinicians, what are you building, growing, or seeking to improve, and how might research help? And we converged on the topic of temporomandibular dysfunction. Next. Which led to our first knowledge translation deliverable, a short, easy-to-interpret summary of the literature providing support for manual therapy for TMD. Next. After that, we sought to expand our reach. So we went to the Wisconsin and Illinois Physical Therapy Associations and asked if there were ways we could help advance their mission using our processes. No surprise, they didn't ask us to embed with them, but they said, we like to do seminars and workshops for our membership. Could you present this information in that form? So we did, not only on TMD, but also on some other topics that were important to their stakeholders. Next. At the end of that process, our reach had expanded outside Marquette to about 400 people, including 150 to 200 people at conferences of like-minded scholars. We were singing to the choir, and about 200 attendees of seminars and workshops, and everything was PT related. Next. So phase 3 was to write about it. We took all the educational content that we had and broke it into smaller chunks in the form of a newsletter or blog. And you can guess from the dates on these posts what happened next. Next slide. Almost immediately after we started writing, the world turned its attention to the coronavirus. Society became inundated with news about diagnostic testing and treatment. There was hand-wringing and even some anger over interventions that were either implemented or discussed. And we realized that everything we were doing to help physical therapists understand how to use research to inform their practice was applicable to what the world was grappling with as it pertained to this virus. Next. So we started writing about those topics. Next slide. One of the pieces that I'm most proud of, and I think best exemplifies what we do, is something we wrote last year around Thanksgiving when we got news that the COVID-19 vaccines were working and would likely be approved soon. Next. As in all our posts, we acknowledged a current event. The vaccines are on their way, and 2 companies have reported that they are 90 to 95% effective. Then we ask a question, what does 90% effective mean? And we introduced a related scientific concept. In this case, it was number needed to treat. Next. Then we explain the study, the data, and the conclusions. For example, this was a randomized controlled trial with an experimental and a control group. Volunteers were followed over time, and investigators counted up the number of people who got COVID-19. We go on to explain that using simple arithmetic, they compute a control event rate and an experimental event rate. Those values are used to compute relative risk reduction, and bang, there it is, 90%. What the newspaper is calling a 90% effective vaccine is what researchers call a relative risk reduction, and this is how they get that number. Next. And finally, back to that thing I wanted to teach you about at the beginning, number needed to treat. It also comes from those same values, and the number is 278, which means that we'll need to vaccinate 278 people to prevent 1 case of COVID-19. Next. So in the before times, we were bridging the gap between research and practice in physical therapy. COVID exposed the fact that the need was not limited to physical therapy. We seized an opportunity to contribute and now realize that what we've really done is expanded our product to address literacy in research and healthcare more broadly so that everyone, not just physical therapists, can make better healthcare decisions. And in my last slide, Sandra, next slide, please. I'd like to acknowledge the contributors, including a number of student research assistants who have helped with the project.
Thanks so much, Sheila. So up next is Dana Cook and Terry Sybil Schmidt, and they're going to be talking about mass vax.
Oh, thank you. Next slide, please. So about 10 months ago, Terry and I started forming a team, and we've been operating on a 100% volunteer basis ever since then and have been growing pretty steadily since we started. Right now we have about 26 active team members, and as you can see, it's a good assortment of computer science and engineering students, a few faculty, and then a number of different software developers, independent consultants, and engineers from industry. And then we have also been very fortunate to be backed by some strong collaborators, including SIM and the Southeast Wisconsin Incident Management Team, which is what we would credit with starting this project in the first place, as well as the local Healthcare Emergency Readiness Coalition. Next. So I'll just did a really quick fly-through demo of our software. There are 2 main elements of the software. The first being the patient registration and scheduling system. So you might be familiar with this if you've already registered for or received the COVID-19 vaccine. So we're collecting the basic demographics, storing this securely on a cloud server, as you can see. And then once the information is submitted, we create a QR code for the patient, as you'll see in the next couple of slides or seconds. This has the encrypted patient identifier. So this is really their key for accessing the vaccination site can quickly look up and retrieve their patient information. And then if you go to the next one, this is a quick demo of our sister application, which is for the point of dispensing or the actual vaccine clinic. So as you could quickly see, you can scan the QR code from the patient. Oh, it went, if you go back one more slide, it skipped one.
Oh, sorry.
That's okay. Yeah, this is the first dose. So it's not playing.
Yeah.
Okay, there you go. So you can scan the QR code, retrieve the patient record, and then, well, review the information, check them in. This is a case of the second dose. We can document electronically their consent form, document the vaccine information as you show it here. And then on the back end, we can automatically transfer this information to the state immunization registry. So eliminating a lot of the manual paperwork that's in the process today in a lot of sites. And this is really the essence of our application. So it is designed to be very simple, streamlined for the practitioner so they can efficiently document the vaccines. Next.
Okay, so a couple key points about the project and the software itself. So the software itself is available as open source. There's no license fees involved for anything that we've developed. We use the MIT open source license specifically, and it is available on GitHub. One of the things that we were very adamant about in this project is we use the agile software development process because most of these students are biomedical or computer science engineers. And we thought it was very important for them to get real world experience. So we used the agile software development process and specifically used Jira as the project management tool. This has been a fantastic real world experience for all of the students, not just for the learning how to develop software as part of a business and as part of a large scale project, but also from a publications point of view and a publicity point of view. Several of the students were interviewed and published through the Wall Street Journal, through Spectrum News, through Channel 12 here in Milwaukee. So there was actually quite a bit of discussion that the students were able to do with outside sources. Furthermore, they've had probably 6 or 7 publications in journals as well as speaking opportunities at trade shows. In terms of the product, another thing that we were very adamant about was using international standards. Specifically, we use HL7 fast healthcare interoperability resources so that this software can be taken anywhere. And the fact that it's international, not just US based, turns out to be really important. Finally, everything that we do is HIPAA compliant. Next. Looking forward. Obviously, we are not safe until everyone is safe. And so one of the things that we are doing is looking at deploying internationally right now, especially to South America and other developing countries. To do that, we have several different pitches that the students are giving actually. One is through FIRE Dev Days, which is arguably the most well-attended conference in healthcare informatics today. The other is through SIM, which, as Dana mentioned, is one of our sponsors. And SIM is Society of Imaging and Informatics in Medicine. And they have an international arm. And they are actually going to be promoting our product during the international conference in 1 month. Finally, really looking forward to when this is all over, we have plans to be able to expand this product to other health emergencies, including even perhaps like flu vaccinations and really the ability to get medical care victims in situations such as hurricanes and flooding. And on that note, on behalf of both Dana and myself, thank you.
Thank you so much, Dana. Thanks, Terry. Right up next is Erin Hoekstra, and she's going to be talking about the impact of COVID-19 pandemic on college student education and career goals. Thanks, Erin.
Thank you. Hi, everyone. I'm enjoying hearing about your interesting research projects today. I'm presenting on a new study about the impact of the pandemic on students' education and career goals, as well as their mental health and well-being. Next slide. Thanks. So I'm working with an undergrad RA through the MU4 Gold program, and we developed and piloted a survey with Marquette students early this spring semester. This was a pilot survey, so we used a convenience sample, which meant that we resulted in a majority of respondents from the Department of Social and Cultural Sciences. This initial survey had just under 50 respondents, and our preliminary data shows that just over half are women, about a quarter are first generation students, college students, and then we also see in the racial breakdown of respondents a slight oversampling for students of color, which reflects the demographics of our department. All of these demographics are particularly salient because the literature about education and career attainment during and after the 2008 recession really demonstrates that disparities break down along gender and racial lines, as well as differences between first generation and non-first generation college students. Next slide. So in the data, we see really an unfolding impact of the pandemic on students' educational goals. So in fact, the pandemic has really caused half of all of our respondents, and that includes 70% of Latinx respondents, to reconsider their plans for education. So this statistic refers really less to their plans for their immediate education, so not necessarily changing their major to focus on another subject area, but it's more about questioning their plans to pursue further education. Almost like 3/4 of our respondents plan to pursue further higher education. They worried about being able mainly to afford this education, as well as the opportunity cost of not getting a job right away after getting their bachelor's. And for first generation students in particular, the financial costs of higher education pose real barriers to these plans for further education. Next slide. Across the board, students reported high levels of anxiety about their career and about their further education options, really revealing kind of generalized feelings of uncertainty about their post-graduation plans and their post-graduation prospects. Part of this we see as fueled by students really struggling with schoolwork and with online learning, as half of respondents reported receiving lower grades than usual in their courses over the past academic year. And then the financial consequences of the pandemic for students and their families have really disproportionately affected first generation college students and students of color. And these students reported higher levels of anxiety, of worry about not only paying for tuition, but also paying for things like food, housing, healthcare, textbooks as a result of pandemic era changes to their financial situation. And then finally, really the primary picture emerging from the survey data is one in which students are struggling with mental health and well-being issues. And so 60% of students surveyed self-reported the pandemic having a pronounced negative effect on their overall mental health and well-being. And half of respondents rated their mental health as either somewhat or extremely bad over the past month. So overall, survey respondents reported high levels of anxiety about the impact of the pandemic on their own mental health and well-being, as well as that of their family members and friends. Next slide, please. Overall, our findings suggest that the pandemic's really exacting a toll on college students who are in this really critical transition to adulthood and are navigating an economic downturn, which really impacts their future education and employment prospects. These feelings of uncertainty, coupled with the additional stressors of online learning this year, the isolation of social distancing, stay-at-home orders, that sort of thing, really deeply impacted students' mental health and well-being. Our data shows especially that first-generation students and students of color are particularly impacted by some of these stressors, especially as they're having to balance heightened family responsibilities and financial challenges with pandemic learning. And so next steps, we're currently fielding the survey with a representative sample of Marquette students, accepting seniors. And then we're planning to expand the survey nationally in early summer and hopefully add in a qualitative piece with a longitudinal aspect of it of interviewing and following up with students annually as they move into like further higher education and into careers. Thank you.
Thanks so much, Erin. That's fascinating. Right, up next is Lisa Edwards, and she's going to be talking about well-being in pregnant Latinx mothers during COVID-19. Thanks, Lisa.
Good afternoon, everyone, and thank you for the opportunity to be here. I want to start by thanking all my co-investigators who are members of the lab, who are master's and doctoral students in our department, and also want to thank our participants, both in our community engaged research and the project that I'll be talking about today. Next, please. So the foundation of the research that we're doing is really about the importance of mothers being emotionally and mentally well during pregnancy. When we talk about perinatal mental health, we are referring to the period of pregnancy all the way up to about a year after a baby is born. And, you know, we've heard a lot about postpartum depression, but perinatal is supposed to encompass an even greater time period. And there is a lot of research that's emerging that suggests that pregnancy in particular is a very important time when moms need to be very well because of some of the effects that can happen if they are overly stressed. So some of the research that we have that's very compelling in the field talks about these negative outcomes for mothers, babies, and families when in fact they experience stress when baby is in utero. So moms can develop depression and mental health concerns. Babies and kids later on in life can experience cognitive and emotional difficulties. When moms are depressed, partners and fathers become depressed. And so it's really critical, again, that we keep moms as emotionally well as possible. If we, adding to stress that moms might feel, Latinx mothers in particular might have other stressors depending on their lack of access to care, acculturation levels, poverty, racism, so many different things that are systemic in nature and environmental, which can contribute to their mental health as well. So compounding the risk that they might have for mental health concerns. Next, please. So then we think about pregnancy during COVID, and what we've seen, obviously, and this is nothing new for everyone, is that there have been incredible disparities with respect to how COVID affects BIPOC, Black, Indigenous, and people of color populations. And so that's one element that is of concern. And then we also have begun to see some research about how stressful being pregnant during COVID is for the general population. You can imagine these changes in types of visits, like more telehealth visits, isolation, and lack of social support. For a while, there were hospitals that weren't even allowing a partner in for the delivery of a baby. And then, you know, oftentimes mothers and parents worry about the health of their child anyways, and their developing fetus. And then you add on the threat of some sort of a significant illness like COVID-19. So that stress has just been immense for mothers across the board. Unfortunately, all the research that we've seen has aggregated moms together of all different ethnic and racial backgrounds. So it's been hard to really understand what might be relevant for Latinx moms in particular. And so that was the purpose of our study, was to really look at the well-being of Latinx moms in a very descriptive kind of overall view during COVID-19. Next, please. So we launched an mixed method study online, Qualtrics, which I think is redundant, but this was a Qualtrics study that we conducted in July 2020. We had about 200 English-speaking Latinx moms. Many were bilingual, but this was a survey that was sent out in English. And as you can tell, we had a majority of Chicano or Mexican participants. And we put in a set of quantitative measures, some of which are included here on this slide, and then some qualitative questions. So I'm only giving you a sample of what we asked about, but we used kind of the gold standard for depressive symptoms, which is called the EPDS. We used actually the GAD-7, Generalized Anxiety Disorder Scale. And then we also wanted to look at well-being through a satisfaction with life scale. And then we asked some real general questions about stressors in life due to being a Latinx mom who's pregnant during COVID, ways that moms are coping, because most of the research that comes out talks about stress and mental health concerns, but doesn't really inquire too much about how people are coping and trying to experience well-being. And then we asked about what might help moms decrease their stress. Next. So here you just see, again, kind of descriptive overall correlations as expected, depressive symptoms related to anxiety symptoms, satisfaction with life negatively related to anxiety and depression. But one of the most important things here are our average scores, our means of these particular measures. What we found is that moms were experiencing moderate levels of depression, which is not good, or depressive symptoms, I should say. That's not good. We don't want any level of depressive symptoms. They were actually experiencing, by the cutoff for the GAD-7, severe anxiety symptoms, which is a great concern. And then their level of satisfaction with life, the cutoff for that was, I think, considered kind of moderate or average. So definitely could have been improved. So that was of concern to us.
10 seconds.
Next. Okay. When we looked at stressors from a qualitative perspective, we saw worrying about illness, money and finances, and the stress from needing to socially distance. Next. Moms were coping by using social support, exercise, and relaxation and self-care. And what was helping them manage their stress, well, what they would like was an end to the pandemic, increased financial support, and social support. Next. So conclusions, we've got moms who are experiencing high levels of distress, and providers need to be very attuned to this in order to be able to support them better. Thank you.
Wow, thanks so much, Lisa. That's fascinating. It's a little bit sad and depressing, but probably not surprising. All right, so thank you so much. So up next, we've got David Ruckey, who is a senior in BISC and also a starting master's student in the exercise science rehab graduate program. And he's going to be talking about the impact of the COVID-19 pandemic on health science career commitment. Thanks, David.
Hello, everyone. Thank you all for tuning in. I've had the privilege to work with an excellent team of researchers at both Marquette University and Concordia University of Wisconsin to assess how COVID-19 has impacted career commitment in our health sciences students. Next slide, please. So the pandemic has affected everybody. It's been particularly challenging for healthcare workers. A survey in August found that 37% of physicians indicated they'd like to retire in the next year. If only a quarter of those actually follow through with it, that's still over 100,000 job vacancies. That only includes physicians. You add in nurses, PAs, etc. That's a lot of job vacancies. We're dependent on new healthcare workers to fill them, and that requires a large body of committed, passionate health science students to come perform those jobs. But as we've seen in previous talks and in the literature, the pandemic's been very challenging for college students, leading to a decline in mental health, a decline in physical activity. So our study aimed to assess how mental health and how physical activity were impacted in health science students and how those factors impacted career commitment. Next slide, please. So we sent an online survey to undergraduate and graduate students at both Marquette and Concordia University of Wisconsin, to everyone besides incoming freshmen. It was completed by 297 students over the summer in the months of July and August. They answered questionnaires about depression, anxiety, physical activity, perceived coronavirus threat, career commitment, as well as some demographic questions. Next slide, please. So of the respondents, there was about a 70-30 split between Marquette and Concordia students. And our sample is predominantly white females, though this is representative of the breakdowns of gender and race at both universities' health science programs. It's not reflective of response bias. In the age group, we saw predominantly college-age students as expected. There was a wide range of from 18 to 42. Next slide, please. So the most significant results we saw were that Clinically significant levels of anxiety and depression were seen in approximately 30% of the respondents. And these high levels of anxiety and depression were correlated with low levels of career commitment. They were also much higher in our female students. Also very important was that 1 in 10 students expressed that their interests had changed due to the pandemic. And in the next slide, we'll talk about some of the reasons why. Next slide, please. So previous studies have found that career commitment declines with the course of a college education. And this is mostly related to internal barriers more than external barriers. One of the most important being perceived ability to meet the demands of the profession. And we found that during the COVID pandemic, both internal and external barriers were very important for these students. So some key barriers were online learning, ability to make a difference, and ability to secure clinical placements, and also mental health was very high. We did see some students express health risks, finances, and family pressure to be reasons whether their interests had changed. Now, not every student whose interests changed was going to abandon healthcare altogether, although some expressed no desire to pursue healthcare anymore. Some decided to instead pursue other facets of healthcare, such as healthcare administration or research. This is important because as the pandemic rages on and we have to evaluate our continuing COVID response, we can target our response towards the specific reasons that are impacting students and hopefully improve their mental health and their career commitment through counseling services, career services, modifying how we perform online learning. Thank you.
Thanks so much, David. Right, so up next we have Dr. Amber Wachowski, and she's going to be talking about political polarization and COVID-19. Thanks, Amber.
Great. Good afternoon. So this research was conducted with 3 undergraduate students late last spring. Next slide, please. So I'm going to begin by taking us back to last spring. Here are survey data looking at the partisan gap in support for various measures to stop the spread of COVID. On the one hand, the divide is pretty clear. Republicans and Democrats differed in their levels of support, but on the other hand, the gap is pretty modest. Large majorities of Republicans and Democrats supported these measures. Next slide, please. But in very short time, this changed. What you see here is the growing partisan divide in opinions between March and April from last year and between late spring and early summer. Now, the next few slides are going to give a slightly longer time frame. So next slide, please. These are survey data collected by UCLA. The left side shows you the partisan gap. The right figure differentiates by geography. In this case, early versus late peak states versus low rate states. So here we see concern about coronavirus. Next slide. Approval of canceling large gatherings. Next slide. Approval of restricting non-essential travel. Next. And approval of closing schools and universities. Next slide. So public opinion data that I gathered as co-PI of NMDSI's 2020 election project also reveal a stark partisan divide. So here you're looking at how partisans rated the importance of different issues in the 2020 presidential election. And the partisan gap on COVID is one of the largest among the battery of issues we asked about. Next slide. And of course, concerns about partisanship, how partisanship is affecting Americans' willingness to physically distance or get vaccinated, or whether they reopened their school districts remain. Next slide, please. So the experimental study that I'm going to show you today was inspired by frustration. You see, last spring, I was looking at those polling data and seeing a glass that was half full. The country was not as deeply polarized at the start of the pandemic. And yet, when I read the news or scrolled Twitter at the time, we weren't talking about the shared support. Instead, it was about red states versus blue states, about Trump voters versus Biden supporters. And indeed, I may have gotten into a little tussle on Twitter with Mike Goucher about whether focusing so much on partisan difference was appropriate at the time. You see, knowing what I know about media framing and affective polarization, I was concerned that media frames emphasizing polarization might actually cause those small gaps to widen into chasms. And so as I was venting to my students, I had an aha moment. Let's actually design a study and put my fear to the test. So we conducted a survey experiment using MTurk in late April 2020. We randomly assigned Republicans and Democrats with equal probability to one of two treatments. Next slide, please. So subjects in both treatment conditions were assigned a news headline about COVID-19 with just minor modifications. So here's the polarization treatment. Next slide, please. And here is the party similarity treatment. Note that in both the numbers are exactly the same, with overwhelming numbers of Republicans and Democrats expressing concern. It's just a slight tweak in framing. Next slide, please. So post-treatment, respondents were asked, do you think the decision to close schools and businesses and to restrict the size of public gatherings is an appropriate response to the coronavirus outbreak, or is it an overreaction that will do more harm than good? Next slide, please. And here are the results. Consistent with our expectation, responses among those assigned to the partisan difference frame were more polarized than those assigned to the partisan similarity frame. Our study was a bit underpowered for Republicans, and so the differences here only reached conventional levels of statistical significance for Democrats, but the larger point about how media discourse can reinforce political polarization holds. Next slide, please. So where do we go from here? Well, I don't think it hurts to have Republican elites and conservative media communicating clear messages about the importance of getting vaccinated. Next. But of course, this is a tall order. So here's a journalist who's posted a video scrolling through the negative and dismissive reactions to Ivanka's Instagram post about getting the shot. And so yes, I would argue we need to do more at the interpersonal level to engage each other across lines of political difference. So I'm going to close by just sharing a very quick personal anecdote. I very rarely comment on Facebook, but last month, my cousin, who isn't particularly political, but is very much embedded within a very conservative social context, posted about how she was hesitant to get the vaccine. As I scrolled through the comments, I read conspiracy theory after conspiracy theory, but I also saw a scattered comment here and there about why my cousin should get the vaccine. And so I rolled up my sleeves and told her about my experience of getting vaccinated and why I chose to do so. I didn't get dunked on like I feared. I think she liked the comment and said something to the effect that she'd think about it. It's a start. Thanks very much.
Wow, thanks so much. That was fascinating. Just fascinating. All right, up next we have Dr. Walter Velowski, and he's going to be talking about empowering those who seek to end hunger. Thanks, Walt.
Thanks so much for having us on. Quick mic check.
Yep, we're good.
Thank you. So I feel incredibly fortunate to be faculty at a university where the president's office itself has garnered financial support from industry partners, and they share in this vision and this desire to have community engaged research. I think we're in a very unique position, and so any opportunity that we get, I feel very fortunate to be able to participate. And what we're doing is we're pairing Marquette data scientists in training with Feeding America Eastern Wisconsin. This is a one-year funding period. It ends June 30. And so what you're getting today is obviously a progress report. Next slide, please. Feeding America over on the left has been providing food to our community for 40 years. And COVID really put an enormous strain on their ability to provide food to those in need. And these numbers are large. They reflect 48 million pounds of food distributed just during a one-year period of the SARS-CoV-2 outbreak. So an enormous strain. And our vision was to pair that need with appropriate skills that students are learning in the data science curriculum. So we are now mutually focused on applying ourselves to ending hunger in our community. How do we do that? Next slide, please. It starts with making sure that the underlying data that Feeding America has in its systems support data science solutions. So we set up a secure data portal, and that's facilitating data exchanges between Feeding America and students at Marquette University. Students worked with our partners at Feeding America first to identify what the data of interest might be, and that's an incredibly rich experience for a student to be able to participate in. And then Feeding America created several extracts, as you can kind of see over on the left-hand side in the blue rectangle. And our students have been actively interrogating these large files and making recommendations about how to clean them, so that they generate a report, they send that back to Feeding America, then Feeding America associates are able to go into the endemic system and make the corresponding changes. And you get a preview here of just the large number of records that students are, guiding Feeding America to go into their systems and correct. And it's an ongoing, it's an iterative process, and it really kind of serves as the foundation for the rest of what you're going to see. Next slide, please. While we were setting up the data portal, we observed that we had expertise in a software solution called Tableau, and Feeding America was already using Tableau. And we wanted to see if there was an opportunity for us to help them optimize how they use that software solution. The goal being, if we can maximize the value that Feeding America is getting while using that software system. It's already in place, it's something that they feel comfortable with. So how can we leverage our expertise to help them? And in just about 2 months' time, maybe even a little bit less, we were able to streamline many different processes and help give back more than 400 hours per year. And what that does is it frees staff up to assert their focus and their subject matter expertise on feeding those in our community, right? There's a lot of people who need food as a function of, unemployment or health conditions, so on and so forth, as a result of the COVID-19 pandemic. And they're able to do that now rather than repeatedly perform the same functions day after day by going into the Tableau software system. So a very subtle story of how we leveraged our expertise with a system that they were already using for overall good. Next slide, please. Making these complex decisions. So they're using Tableau to help make decisions in the business space. So making those complex decisions quickly often requires a tailored approach. So Tableau doesn't necessarily handle all the different needs that an organization like Feeding America has. So using design thinking principles, we embedded our students with Feeding America leadership to identify, and as a group, they identified 9 priorities that are listed over on the left. And those are priorities for a de novo interactive application that the students are actually building. And you can see that 4 of these pages, denoted by an X, have been developed already. And you can see here on the right-hand side, this is just a screen grab of us kind of working in our virtual space, but this is the product aging page that we are now continuing to revise with our partners at Feeding America. And making decisions supported by the actual data. So these pages now are actually generated from the data on the Feeding America side. They're going to help our partners better manage food resources, their food inventory, the 48 million pounds of food. They're going to help with assessing donation patterns and understanding who in the community is giving them food. And they don't have to comb through pages and pages of reports. That gives them more time to get out in the community and end hunger. Next slide, please. In addition to helping Feeding America make decisions today, our students are also applying their skills to build a sustainable landscape where the partners benefit from data mining techniques that are taught in business analytics. So students are taking incredibly large data sets. You can see 550,000 tuples in this situation. And they're experience. So students are getting that experience as well. And then they're applying these techniques to better understand or to uncover underlying patterns in things like when Feeding America acts.
All right, it's freezing on everyone else. Okay.
Yeah, for me too.
Yep,
Okay.
I think we lost him.
Okay, I think we'll have to move on then.
That was his last slide anyhow. I think he just had one more. Why don't you go to the next slide so you can put up the students?
Yep. Okay, thanks, P, and you're involved in this. Okay, thank you. All
yeah,
right,
so
we'll
the finishing of this was basically that it was done by a lot of graduate students, and it was impactful from a industry product development perspective. Thank you.
Thank you for filling in. All right, well, thanks, Paula, and thanks, Walt. So up next is Gabe Velez from the Educational Policy and Leadership Department, and he is going to be talking about developing during COVID-19 children and adolescent experiences of the pandemic. Thanks, Gabe.
Thank you, Sandra. And hey, everyone who's out there. It's nice to be in the virtual space with you, although I do look forward to being in person, hopefully in not too long, for these kind of events. I want to thank to start some of my collaborators, Sam Niemanich in Department of Occupational Therapy. Some of the data I will be sharing today is from his work, and we actually got connected originally on the first round of these talks when we both presented, and then have sort of built a little bit of a collaboration out of it. And then also the students who've worked on this, who are students in the College of Education, Maddie Hahn, Brian Troyer, and Kennedy Latham. So if you could go to the first slide. Much like Amber, I think some of this work has developed out of some of my own frustrations, particularly what I saw in the media just about a year ago. And some of what I was seeing then was a lot of talk about young people, and I think it still continues, although there has been growing amounts of data on what they're actually experiencing. But there was sort of all this talk about young people, right? Young people are not going to be able to the same after the pandemic. Or I also saw a lot of news stories, which, to be fair, I think we're trying to do justice, but we're drawing on, one or two stories, and there weren't really studies and data out there. And so I felt like, this was a real opportunity to get a better sense of giving voice to these young people and trying to do it in a little bit more of an extended and systematic way and collect some data. Go to the next slide, Sandra, please. So the project is kind of developed in this way. And so last spring, when I was sitting around thinking about this, thinking about how I was struggling to cope and handle and process what was going on, and then wondering what this meant for adolescents in terms of their development, which is really my focus and my interests. So I was able to get out a survey of adolescents in the spring last year. And then sort of over the summer, and this was happening, without sort of my knowledge, we hadn't yet connected, but Sam got out a survey of parents who had children and adolescents about what their children and adolescents were going through. And then in the fall, and this is when we sort of started to connect, I did a second round survey of adolescents, and I'll speak a little bit how the two are connected. And then Sam did a follow-up second survey with the parents that he had spoken with. And then we have both collaborated now in the winter on doing some interviews with a small subsection of the adolescents that I surveyed who participated in the spring last year, in the fall, and then have now in these interviews. And then we kind of expanded that also to try and include some of their parent voices in those interviews to get that outside perspective. So we have a little bit of sort of that subset that's a longitudinal sample. Sandra, if you can go to the next slide, please. So the way that these samples kind of work out for the student surveys, the two rounds had a little bit of overlap, but they were sort of independent, actually, partly because of the schools that engaged and involved in all the dynamics going on for young people in their schools at the time. But for the round one last spring, we had about 800, and then we had over 2,000 for the one this past fall. And then this longitudinal sort of group that has been participating in both of the surveys and then also doing interviews right now is at 19 adolescents. And then for Sam's work in his two rounds with parents, he had 336 in the first, and then 150 in the second. So then what we sort of asked about was kind of basically about what young people were going through, what these children and adolescents were experiencing. And so from Sam's survey data, some of his round one findings included things about their physical activity being minimally different, but their electronics use increasing, negative mood signs increasing, and change in sleep patterns. And then one of the interesting things for me and where our work is sort of coming together was that some of these effects, though, were much stronger in the adolescents, or for, I should say, the adolescents. The parents were expressing these, the parents of adolescents were expressing these more so. And so that was saying that, adolescents were using electronics even more. They were decreasing in physical activity more. There were more negative mood signs, and their sleep patterns were even more changed versus the parents who were talking about younger children. Can you go to the next slide, please, Sandra? From some of the student findings, and this is looking at the fall survey, but really generally across the two, one of the interesting things, it had a close-ended question asking them about their thinking about the future. And many of them were very hopeful about the future. We had about 80 to 90% consistently who were saying that they strongly agreed or mostly agreed with this idea that I am hopeful about the future. Levels of trust were very low, though. And so this was something we asked them on this scale of how much do you trust these following institutions. Schools were the highest, and I think that's an interesting element when we consider that they were remote and largely disconnected from a lot of the things in their schools that they may have been relying on and had that trust in. The second one, too, on just a larger note, is sort of interesting. As part of this scale, it included things like the police and political parties. And the police was actually highly rated in this scale, but that was a very divided number there. So you're seeing there the average, but that really, I think, glosses over the fact that there were many who had high trust in the police and then many who had very low trust in the police. Sandra, can you go to the next slide? So here's kind of getting into some of the general takeaways, and I was trying to sort of synthesize this a little bit. And this is from some of the qualitative responses where we asked them about a lot of different things. But sort of a general takeaway, I think, is that the isolation across their daily routines, their activities, the social life, school, and then that was all connected to mental health, right? And so these were things that weren't isolated in the sense of like, okay, my school has gone remote and now I'm struggling with my learning, or I can't see my friends and that really stinks, right? These things were all intricately connected. So their routine of going to school was disrupting things like their sleeping, which speaks to some of Sam's work, right? Or their social life was affecting just their mental health, which then tied into their schooling, or being disconnected from teachers and missing the moments in the hallways in the school, which were important for their social life, then left them feeling isolated and struggled with the mental health. And so these things were integrally related. A couple sort of themes that I pulled that I want to sort of emphasize too. I would say in the most recent survey and then into these interviews, one of the things is that as this has gone on, this kind of COVID life is normalizing for many. So this is an interesting finding because there's a lot of research out there actually that mental health concerns with adolescents have been increasing. So by number of ER visits, mental health resources being used. But I think there is also a space that for many young people, as you know, this has gone on and gotten into now a year into it, they felt like they've sort of adapted in some way. And not that it's something that they enjoy, but that they've kind of come to sort of figure out how I can function and be resilient amid all this going on. I will say that that sort of balances with the second point, which is that this continued stress from COVID-19 and then also the remote schooling really is impacting their mental health. And the remote schooling comes from also looking at those students who reported that they were still doing virtual learning and those who were doing either in-person or hybrid, where that element of being in a school was really helping them feel grounded and connected and motivated again. And that sort of ties into the last part where their schooling experiences were sort of mixed. There were some who found the online positive, but they were often describing that a lot of it had to do with the people around them. And what I mean by that was sort of whether teachers were understanding of all they were going through, how the teachers were connecting with them outside of the learning, or if they were back in person, if they felt that their schools were responsive to what they were feeling, or if they felt that their schools were treating them sort of in a way that they had a voice in what was going on or were a part of it. And then lastly, I'm not really going to get into some of the subgroup analyses and things, but one thing I did want to mention, which I think is important to keep in mind, and as we think about the communities that have been harder hit by COVID-19, the Latino and Latina students in the sample more often talked about mental health concerns, and then particularly in relation to their school experiences in the fall. So saying that the sort of the struggles they're having with learning with their school were tying into greater rates of stress and anxiety and lack of motivation that they felt. Sandra, can you go to the next slide, please? So I just kind of wanted to end by highlighting some of the next steps, and I'm happy to put, in the College of Ed, we created a page for this work that I'm doing, so I have there sort of the full reports with much more information if anyone wants to follow up. But right now we're analyzing these interviews from the winter that we've done with this follow-up group, and I think we're going to try and continue with them again. So much like Aaron was talking about, we're going to try and do this as longitudinal, partly because I see this as trying to get at what are the impacts on their development of this. And so we got this survey marker with these young people from a year ago, one in the fall, then we've interviewed some of them, and if we can do that again in 6 months to a year and kind of seeing how this experience is carrying with them and its impacts. And then lastly, continue to kind of disseminate this. A lot of what I've been trying to do because I work so closely with schools was getting out quickly some analyses to schools. And so I created reports that were both overall and then for the individual schools who participated by sending this out and trying to get their students to be a part of it. And so now I'm sort of turning to the academic focus and trying to analyze it a little bit more in depth. So thank you all, and I'm excited to see some more research.
Yeah, thank you so much. It's just tremendous work, and it's great to see the development of this work and how it's really evolved, and the collaboration also with Sam. Thanks so much. So up next, we have Amy Van Hecke from Psychology, and she's going to be talking about autism. And, actually, Rachel is talking, one of the co-investigators, autism and online versus in-person social interaction during COVID-18.
Sorry, that was a typo.
I didn't catch that. I would have changed it. Okay, thanks so much, Rachel.
Thank you. So I'm here to talk about some research the Marquette Autism Initiative has been conducting on the experiences of autistic adults during the COVID-19 pandemic. So we wanted to look at the ways social interaction has changed and how that relates to mental health. As we know, social isolation is related to many mental and physical health problems. Since autism spectrum disorder is a developmental condition characterized by social and relationship difficulties, we kind of had the idea that this might not be the same experience as it may be for non-autistic individuals, but there really hasn't been research into how autistic people interact online versus in person. So this was a very exploratory, kind of open-ended study to get an idea of what people's experiences are like and what we might want to investigate in the future. So we can go to the next slide. So we created an online survey that used open-ended questions to ask autistic adults to describe their experiences with online and in-person social interaction before and during the COVID-19 pandemic and the subsequent relationship to their mental health. So we had 83 autistic adults from the United States participating in our study, and their responses were analyzed for just general themes, as well as looking for descriptions of any specific mental health symptoms, and then what they characterized as like the overall change in mental health symptoms over the course of the pandemic. I'm kind of skipping over a lot of the introductory detail here because as a qualitative study, there was a lot in the results, and I want time to kind of dig into that without kind of glossing over things too much. So if you could go to the next slide. What we found was probably unexpectedly, the majority of participants said that their mental health got worse over the course of the pandemic. But surprisingly, a number of people said that their mental health improved in like all areas. Just overall, they said, I'm doing great, I'm thriving, this is the best I've ever felt. And then another portion said their mental health had gotten better in some ways and then worse in others. So maybe their anxiety about getting COVID-19 got worse, but maybe their depression or like day-to-day anxiety about other things got much better. Next slide. Participants described a variety of mental health symptoms. And important to note, again, this was an open-ended qualitative study, so this is just what people brought up in their narratives. People may have experienced these symptoms and just not mentioned it. So as it was just exploring people's experiences, we weren't using mental health measures at this time, but this is just people brought up, when asked what they were struggling with, asked about their mental health. These are things people described. So the majority of people described depression and then anxiety disorders, including panic and phobias, which is probably unsurprising given the rates we're seeing increases in the general population of anxiety and depression across the course of the pandemic. A small portion also described their symptoms of autism worsening, so maybe having decreased social skills or increased sensitivity to sensory experiences like sound and light. And then another portion of participants just described general stress and loneliness, although they didn't connect it to any specific mental health diagnosis. Next slide. A major theme in the data was the importance of in-person interaction. Many participants reported intense loneliness during COVID-19 and said that the decreased in-person interaction worsened their mental health. On the other hand, they also said pretty clearly that in-person interaction was difficult. So some people talked about getting too much interaction before COVID-19, which they found overwhelming and draining. In fact, in-person interaction was often talked about as detrimental to mental health and explained why some people experienced improvements in their mental health during the pandemic because they didn't have to deal with something that was so exhausting to them. Next slide. Participants also talked about online interaction as a lifeline, not just during the COVID-19 pandemic, but during other times of isolation as well. They said it made it easier to form social connections and significantly benefited their mental health. So given those kind of complex responses to online versus in-person interaction, it's probably unsurprising that people had pretty varied perspectives on the shift to online interaction. Some of them preferred the new normal of primarily online interaction, finding it easier and less draining and allowing them more time for self-care because they weren't using all of their energy on in-person and social interactions. These are people that would say that they were thriving, they were just doing the best they've ever done because they were not having to spend all of their time and energy on social interactions they found very difficult. But others preferred the old normal of primarily in-person interaction, saying that online interaction was not the same and that they were very lonely and touch-starved. So even if there were benefits to, even if these were people who previously had, too much in-person interaction, now they were getting too little, and that wasn't necessarily an improvement. And then a small group of individuals said that nothing had really changed for them because either due to physical health, social struggles, or location, they were already pretty isolated and had primarily socialized online even before the pandemic. So this was basically everyone else was now doing what they had already been doing. All right, next slide. So it's clear that in-person interaction can affect mental health both positively and negatively for autistic adults. Balance between the two is pretty key. Some amount of in-person interaction is necessary, but too much may be overwhelming and can make people feel even more isolated. Online interaction is also important for mental health, as it's more accessible for autistic adults and provides ways for autistic people to engage with their communities, particularly when socially isolated. The varied perspectives on the shift to online interaction really highlight the diverse experiences of autistic adults and show the importance of paying attention to people's unique needs. Some people will need more in-person interaction and others will need more online interaction, and a various mix between the two. It's important to provide accessible options for interaction both in person and online. A more accessible in-person experience could look like decreasing noise and bright lights and the general busyness of social spaces, while online accessibility could mean providing options for autistic people to participate using video calls or chat systems rather than requiring in-person meetings. For autistic people who were already isolated prior to the pandemic, the new options for interacting online have opened up a lot of doors, and we should be careful of closing them on the assumption that in-person is automatically better for everyone. The biggest takeaway is that autistic people's social and mental health needs vary, and it's important to listen to people and take into account their unique experience. While many people are excited to get back to the old normal, it wasn't always, arranged in the best or most accessible way for a lot of people. And hopefully we can use this experience to create a more inclusive society for autistic adults in the future. Thank you.
Thanks so much, Rachel. That was fascinating. There's obviously a common theme across many of these studies about mental health. So for our last talk, Dean Cullinan from the College of Health Sciences, honoured to have him speak.
Oh, yeah.
And he's going to send us off with a fascinating talk called Sustaining Campus Connections and Culture in a COVID-19 Pandemic, a Case Study.
All
Thanks,
right.
Phil.
Thank you. I teach from 3 to 4 and just got back. I was afraid I would miss all of this. So I apologize to all the speakers. I haven't heard any of your discussions, and I'm sure they were fascinating just looking at the talk titles. I was involved in teaching in 2 courses, including one undergraduate course in gross anatomy when the pandemic hit and we all went remote. And this is a kind of special problem because these students see this course as well, one of the major reasons why they are at Marquette University, because it's unusual to be able to do a full cadaveric dissection as an undergrad. And they were pretty depressed. And if you can advance to the next slide. This is the way I saw campus in the months after COVID. Now, I never really went away. I guess I hung around, and I don't work well from home, but I had other reasons to be nearby. That is, if nothing else, to walk through the halls of some of the research areas and make sure that -80 freezers didn't poop out, which is a catastrophe, I can tell you, if you've ever experienced something like that. But I saw very little activity on campus, and I got this idea, if you could go to the next one, to kind of bring the campus to students. And so since it was anatomy, I took an afternoon and I was surprised. I took a walk around campus, found out 2 things. One, my AD gets me into pretty much everything. And so I started going into places like the law school and into across the campus. And if you just hit the next slide, the idea was to take a picture of some iconic campus thing and have students guess what it is. That is, I emailed it out to the class, and I can tell you everybody got this one. And if you believe that students don't communicate via email, I would get replies like within 20 seconds of sending this thing out. And my whole box would just blow up with 100 responses or guesses. Now, if you go to the next one, it's this one is a little more difficult. There's a couple of cherubs around the Joan of Arc chapel. And this was a foot. This was one of the most difficult ones. How about the next one? Yeah, we probably all recognize this as the Mary statue in the Marian Grotto. How about the next? This is a hard one. You have to kind of be on the west side of campus. This is the little kid that Mother Teresa's holding, and that's her foot from the same statue. You can go with the next one. That's, of course, from the Statue of the Resurrection, or as the students like to call it, Toilet Paper Jesus. This was, again, another tough one. This is the face of the Sir Thomas More statue in the law school. And this one I had the most fun with, which is, of course, Father Marquette's nose given away by the bridge of the library behind it. Okay, you can switch to the next slide. So that went over pretty well. It also turned out that the so-called Marquette turkey, yeah, you can sort of play that, made an appearance. So I followed him around for a week. He pretty reliably met me at my car almost most days. But this time I saw him down by the Al McGuire Center. And there's one part up here that's interesting to see. The streets are kind of deserted, but critically, so is the entire Zilber Hall parking lot. There wasn't a single car. And the bird was fairly accommodating. I mean, I got pretty close. A couple of times later, I got much closer, but, you know, I think he almost got hit by a bus at the end of this particular clip, which ends there. Okay, so if you could go to the next slide. All right, so this is a kind of interesting story. If you just advance it a couple of times, there's a young woman that I was involved in recruiting out of high school, and her mother put all this on social media. They wanted to have a graduation ceremony for her during the pandemic, and I had agreed to come. Just shortly after that, the city induced or the state put out its safer at home mandate. So I felt really funny about getting out of the car. So I didn't get out of the car, but I left a cardboard cutout of myself for the party. I was able to mask and glove up and hand her diploma, as they had set up a little car parade in her cul-de-sac somewhere near Brookfield. So we found another use for the cutout a little bit later. You can go to the next slide. It's just kind of hung around in the office and reminded folks to wear a mask. All right, the next slide. And then finally, you know, to kind of make these folks whole, this is just a sample of the students who were displaced in their gross anatomy course. And they were, you know, we completed the course virtually, which is somewhat unfulfilling, but invited them back on Friday afternoons in the fall. Fortunately, most of them were underclassmen and could come back and complete their dissections after the course was over, but yet just for the sheer fun of it, which they all did. Now, there's another tradition in the course, if you can advance the slide. It's customary for them to take a team picture out in the front of the building, which of course we were never able to assemble, but we are in the process of cloning in their faces onto the bodies of this former class. So the students elected that that would be the next best thing. Now that's a pretty big job, so we're still at it, but we hope by the end of this semester to be able to send them that photo. And if you go to the last one, I just think collectively all of these things help students stay connected to Marquette's campus, and you know, supporting morale is something that's always useful. Okay, so that'll do it. Thank you so much.
Thank you so much. That was a wonderful way to end this lightning talk. So it was just fabulous. So I can tell you that there's some themes that we've seen, which I'm just so happy about, and that is that we're starting to see results of many of the studies that started a year ago when we started these lightning talks. And it was exactly a year ago this week that we had our first town hall, and there was over 100 people who came to this. Wow. And started to form collaborations, which you can see the product of today. There's also been a theme of mental health in people with autism, just adults in general, student populations, in adolescents, and just minority groups. There's a real theme there that we're seeing across many of these studies. And you can see that, and the last thing that I really want to emphasize is, which is where I started in my talk, is the student involvement. And I can just see that students are embedded in everything that we're doing and are just the foundation of everything we do. So I'm feeling like that that article that I wrote back in October in Medium is even more important because it's around the students and their discovery in research and also in teaching, which Bill highlighted really well there. So thank you so much. I'm really so pleased that that we had 12 speakers and we're starting to see the results. And I think we're going to continue this tradition. I think we're onto something really nice here. So thanks again. Thanks to Mike, Haisha, and to Mel, Mel Baker from the the Research and Innovation Office, and Mike, who supported this, and Kat also. We've got a team that behind the scenes that makes all this happen. So thank you so much.